COVID-19 vaccines and blood clots have been a discussion topic in recent times. Much has been said about it, and I will give you an update of the current knowledge on this topic. This slide will give you the vaccines that have been authorized so far. Some are RNA vaccines, some are viral vector vaccines, and there is an inactivated vaccine, and the other characteristics of these vaccines are given in the slide. In February 2021, there was a report of bleeding without thrombosis following the Pfizer and Moderna vaccine. Now, the blood clots are thrombosis. Bleeding could occur due to low platelets. So here there was bleeding without thrombosis. That's important. There were 20 case reports. Later on, Denmark, Norway, Iceland suspended the use of the AstraZeneca vaccine because of the concern of blood clots. The UK, Australia continued using it. Shortly after that, reports appeared in the New England Journal of Medicine of thrombosis and thrombocytopenia. Thrombocytopenia means reduced platelet count, which can lead to bleeding. These were two of the reports that appeared, and then the third report linked it to be due to an antibody against platelet factor 4 as the cause for the thrombosis and the thrombocytopenia, or the low platelet count, that was seen in a small number of patients. Soon after that, the thrombotic thrombocytopenia was also noted in a few patients who received the J&J vaccine. And this vaccine was held back for a short period by the FDA and the CDC, and then recommenced once they did their investigation, and this was similar in the European Union. So what is the current data with regards to blood clots and low platelets with the AstraZeneca vaccine in the UK? 28 million doses have already been administered, and there have been 242 blood clots. The overall rate with the first dose is 10.5 per million. That is about 1 in 100,000. The second dose is 1 per million. So you could immediately see that it's second dose, it's very much more rarer than with the first dose. The MHRA takes this into account, and at present, they find that the AstraZeneca vaccine is favorable in the older population, and in the younger population, it is more finely balanced, which I will discuss in the slide that follows later. So with regards to the J&J vaccine, 12 cases were reported recently. All were women younger than 60 years. The symptom onset was between 6 and 15 days after the vaccine. Now, of the participants who were tested for this PF4 antibodies or HIT antibody, all were positive. 3 died, 4 were discharged home, and some needed ICU care. So the incidence of vaccine-induced thrombosis and thrombocytopenia is 1 case per 26,000 doses to 1 case per 127,000 doses, and nearly all are reported after the first dose. In the UK, it's about 1 per 100,000. With J&J vaccine, a few reported cases, and it's approximately 1 case per 500,000 doses. Now, we have to note that both these are viral vector vaccines, and there have been no reports with the mRNA vaccines. This gives the risk of blood clots with a vaccine at is 0.000, etc., with the J&J vaccine and also with AstraZeneca vaccine, while the risk of blood clots with COVID is so many times higher. And this is something that people must remember, because the risk of getting COVID and getting blood clots is very much higher than getting blood clots after vaccine. And also, the birth control pill and cigarette smoking increase in risk of blood clots is shown in this slide. So there are certain characteristics, symptoms, and signs which people are told to look for: persistent headache, focal neurological sign, seizures, etc. And they are told to report this immediately to a medical team if this is noted after a vaccine. And there are nice schematics which are in place to be able to investigate and diagnose it. If these features are present after vaccine, that is 4 to 26 days or 28 days, you find that a full blood count is done. If that shows decreased platelet count, then other tests are done, including imaging. And at that stage, you would do the appropriate antibody test. If these features are not met, then you would go ahead and look for other cause of thrombosis. So this is an important aspect to remember when investigating this group of patients. So what is so different with this entity, WIT? You find that the key processes of thrombus and thrombocytopenia occurring, that is low platelet and thrombosis. Then in addition, it occurs in certain unusual areas, that is cerebral venous sinuses or in the splanchnic circulation. And it should not be treated using heparin. There are other treatment options as given in the slide, including IVIG. It should not be treated using heparin. And secondly, you have an antibody level that can be measured to make the diagnosis. So this is again some important features: no heparin, you avoid platelet transfusions, and you consult a hematologist and get advice from the hematologist. You take the blood test, the antibody test before giving IVIG, and IVIG is recommended as treatment if this condition is diagnosed. So let us finally come to the potential benefits and harms of the AstraZeneca vaccine in a low exposure setting and a high exposure setting. So low exposure at the moment would be something like the UK, where in those between the age of 60 and 69, you can see the ICU admissions, that is the last row. ICU admissions is quite high if you get COVID, as opposed to any danger from the vaccine, which is 0.2. So you would definitely find the AstraZeneca vaccine to be safe in this age group. But when it comes to 29 to 29-year age group, you can find that it becomes more equivalent. And that is why at the present time in the UK, those under the age, initially it was those under the age of 30 who were not given the AstraZeneca and were given an alternate vaccine, but now the age has been shifted to 40 years, and those under the age of 40 are given an alternate vaccine. However, we must remember, in a high exposure setting, like in India, the equation is changed, and at all age groups, the benefit from the AstraZeneca vaccine outweighs any risk that can occur from the vaccine. So therefore, depending on the exposure, the risk-benefit ratio would alter with regards to both the AstraZeneca and the J&J vaccine. So in summary, of the different vaccines that have been authorized so far, blood clots, that is the condition called VITT, has been reported in a small number of patients who received the AstraZeneca and the J&J vaccine. However, the overall benefit of vaccination outweighs this risk and the danger from COVID-19 and thrombosis. In different countries, different age groups are taken with regards to administering the AstraZeneca vaccine. Thank you.